in-depth coverage of the tragedy in Taunton continues now. Joining us in studio this morning, Dr. Maggie Bublitz. She's the clinical psychologist at the Women's Medicine Collaborative in Providence. Thanks for coming in and joining us this morning. I want to talk about more about what happened last week in Taunton, and tell us the prevalence of mental health disorders and the treatment process, and what happened, not necessarily what happened last week and what didn't happen, but how common this is where someone doesn't maybe get the proper care that they really need.
Right, and it is a big problem. So 1 in 4 Americans have a mental illness in a given year. And the risk is even greater among women, so women are twice as likely to experience a depressive episode. So it's a huge concern both for the individual and then as a country. Not only can it lead to tragedies such as the one we just experienced, but it's also very costly.
There's also a stigma that goes along with mental health problems, and it's not like, you have a broken arm, you get a cast, it gets fixed. If something's wrong with somebody's brain or their mental health, you can't necessarily see it. Some people are embarrassed about it, don't want to talk about it. That seems to have changed, though, over the past, 10 to 15 years.
I think stigma is decreasing. One of the major barriers that we still are facing is accessing mental health care. And actually, the majority of mental health treatment is occurring in the primary care office. So traditionally, when patients are concerned about a mental health problem, they're going to go to their primary care doctor to talk about it. And that will then lead to getting a referral to a specialty mental health clinic. The problem is that 30 to 50% of individuals who receive the referral will never make an appointment. And if they do call, wait times can sometimes be so long that they kind of lose the motivation to go.
Do you suggest people that might be watching at home skip the primary care physician step and skip the referral and just go right to the source? Is that possible?
Well, it's one direction. It's not what I would suggest. And actually, new programs are being developed now that provide mental health treatment in the primary care office. So the hope is that those types of programs improve access and decrease wait times. And it's also potentially a more comfortable environment for patients to be talking about their mental health concerns. Absolutely. So there's a group in Rhode Island called the Care Transformation Collaborative. They're actually starting to fund these programs. So Women's Medicine Collaborative is one of them, where we're now having mental health in the primary care office. So patients can say to their doctor, hey, I haven't been feeling so great emotionally. What should I do about it? And they can say, we have somebody right here today who you can talk to.
All right, we have about 30 seconds left. If anyone is watching and they want to know more about what you do and where you're located, a website, what other information can you provide?
Well, I would encourage them to go to the Care Transformation Collaborative website, and I would encourage them to talk to their primary care provider, who will know who in the community these patients can talk to. And globally, I think having these types of programs available to patients is really going to improve their ability to receive care.
All right, Maggie, thanks so much for coming in this morning. We really appreciate it. And for more on this topic, of course, you can just head to our website, WPRI.com.